My name is Dr. Ken Alleyne, a sports medicine and joint reconstruction surgeon. And we have a series of videos that we're going to discuss some of the more common things that we see here in my orthopedic surgery and sports medicine practice. By way of background, I am a board-certified orthopedic surgeon. My training has occurred at many places around the country, including Williams College, Medical School at Wake Forest University, Howard University Hospital for residency, Yale University for my sports medicine fellowship, and then a research fellowship at Harvard MIT in Cambridge. The majority of my practice are problems of the knee and shoulder, and our practice here at Eastern Orthopedics and Sports Medicine ranges from school-age kids to active seniors, professional athletes, collegiate athletes, and Olympic athletes. So we have a pretty diverse practice. What we'd like to do today is discuss a series of the more common things that we see in hopes that it will help to direct our patients in their care to ask the appropriate questions of their doctor and to make sure that they have good information in regards to their orthopedic concerns. One of the more common questions that I receive in the office is, Dr. Alleyne, what is sports medicine? What makes you a sports medicine physician, or your practice a sports medicine practice? And I certainly understand the confusion. In 2012, many practices, both doctor practices and non-physician practices such as physical therapy, will utilize the term sports medicine. And generally that means to impart to potential patients that they're involved in the care of people with active lifestyles, whether those are athletes, non-athletes, or seniors who just want to maintain a certain level of activity. For some of us, sports medicine is a little more than that. It is a dedication to obtaining certain skills that are utilized to restore people back to active lifestyle. In my practice, that means school-age students to professional athletes, collegiate athletes, Olympic athletes, or active seniors, utilizing a special group of techniques. In addition, it's a commitment to lifelong learning of non-operative management of problems in that same group of individuals. Everything that we see in a sports medicine practice does not require surgery. In fact, the vast majority of patients, at least in our practice, don't receive surgery, and we're very happy that we're able to return them to an active lifestyle. Things that you may want to inquire about to differentiate between a true sports medicine physician and an entity that may just be saying that they do sports medicine is their experience and their training. There was a time when there were not sports medicine fellowships, but yet many surgeons who became very skilled in some of the procedures that we utilize today. And so discussing with your doctor how often they do a procedure, i.e. how frequently they do a procedure and for how long they've been doing it, is certainly a reasonable question. In addition, it's helpful to know, are there any specialized training or certifications? In the instance of my practice, I spent an extra year at Yale University just dealing with athletes and active people and honing my skills in the operative and non-operative treatment of active people. Again, there in New Haven, we treated everyone from school-age children to professional athletes, certainly collegiate athletes. We were the team physicians for the university, and active people in general, utilizing a very specialized set of skills for the non-operative as well as operative management. I then spent another year in a research fellowship at Harvard MIT, where we researched materials to help make sports medicine and other devices that will help to restore people back to their active lifestyles sooner. In fact, one of the devices that we're working on now is a bioengineered ligament reconstruction for ACL. Soon we'll be starting European clinical trials on this new ligament based on some of the research we did at Harvard MIT, which may obviate the need for us to take a tendon from the patient or a cadaver to restore ligament function. Sports medicine physicians come in all types, and their training can be from a vast majority of places. The questions that you really do want to ask, though, surround what type of training you've had, how often and how long have you done these procedures, what sort of therapy is required after, and what sort of outcomes do you generally see. I think if you ask those questions and come to your doctor with any other questions that you have, it helps to open up the communication and make for a much more rewarding experience for the physician and the patient. Places that you might find sports medicine physicians working, every professional major team and non-major team in the United States usually has a sports medicine physician. High schools, middle schools, club teams often have sports medicine physicians involved. For me, I've enjoyed the opportunity to work with the United States Open Tennis, as well as United States Olympic teams, both in cycling and boxing. But sports medicine physicians are out there helping keep people active, both professional athletes, collegiate, Olympic, and just folks who enjoy being active all over the country. Seek out a sports medicine physician should you have an injury, and for further information, don't hesitate to contact us at www.eosm.net.